Welcome back to Real People, Real Stories, where we get into individuals who have been diagnosed with an autoimmune disease, and we want to hear from them exactly what is going on. And today we have Chaundra Davis, and let me start off by saying I'm so excited that you're here.
Glad to
Your
be here.
your information is invaluable, so we're going to get right into it. What is your official diagnosis?
Since we last spoke, that has shifted, so keep that in mind. As of right now, I am dealing with fibromyalgia. I was recently referred to rheumatology to delve deeper into some issues and have been cleared of rheum autoimmune, but there's concerns about neurological autoimmune, so I will be starting a new course of testing at the beginning of the year.
Wow. It's amazing because I've been looking at a lot of research and it's saying if you have one autoimmune disease, usually there are multiple,
Yes,
even though some of them may never manifest themselves.
yes.
Do you or have they shared with you the type of testing that you'll have to encounter?
They have not as of yet. When I got sent to rheumatology, it was based mainly on some familial history and some blood work. And there are certain numbers that they're looking at that when my journey first started were what they called borderline, and then over the months and then subsequently over a year, they continue to increase into numbers that are like, there's some concerns. Um, you definitely have to advocate for yourself, which has
Yes.
been a big part of this journey because, I'm not Dr. Google, but when I see something that's increasing, I'm looking at it and going, what is this?
Hmm.
Researching it and seeing what the research shows and saying, hey, we need to be asking some questions about this. And finally got the referral to rheumatology because I have a brother who has Sjogren's.
Ah,
And so it
interesting.
was like, that's just another, particular piece
Hmm.
in the puzzle to know that my brother, who I did not know existed until a couple of years ago,
Hmm.
has Sjogren's. So it's like, and so I really pushed to get to rheumatology, and they ran their standard battery of tests. And based on what they see with blood work and some physical testing of joints and things of that nature, along with my history, they determined that it is an autoimmune issue, but
Hmm.
it is not rheumatological specifically. So I had the initial diagnosis of fibromyalgia when they didn't know what it was. It
Hmm.
was just, there's a lot of pain, there's a lot of uh, emotional component as well, because, when you can't get out of the bed, when you're used to doing,
Absolutely.
just doing what you do, and all of a sudden it's like, one doctor said it was perimenopause. And so then I was encouraged to seek a female doctor, just because it was kind of like it's just this.
Hmm.
And so when some of the symptoms became more unusual, it's like, this is not perimenopause or menopause. This
Hmm.
is something not right. But a lot of time just being in the bed and not feeling good. And so once I did speak to a different provider and gave them the information, they did some touch tests and things of
Hmm.
that nature. And that was what the official diagnosis became, as far as formulating a treatment plan,
Okay.
um, and putting me on some meds to help with that. When other symptoms started to appear,
Hmm.
it was then we need to determine whether or not it's the meds that is causing these symptoms or something else. And so I had to go to a course of completely coming off of the meds. And we did that for 3 months off of the meds to make sure they were completely out of my
Wow.
system. And the issue still was there. So that is what kind of pivoted the journey from, yes, this seemed like fibromyalgia and it read
Hmm.
like fibromyalgia, and But now that we're looking at other things, we're not 100% sure that's what this is.
I tell you, Chaundra, you have said a mouthful of invaluable information. The fact that you shared that your brother had an autoimmune diagnosis, and just from a lot of research, you will find that sibling groups or it's hereditary with autoimmune disease.
Yes, ma'am.
And a lot of times you don't know it. I didn't know it.
Yeah.
All I knew is my mom died extremely early.
Yes.
But with my diagnosis, then looking at other families throughout, it's rampant throughout our family.
Yes.
Now, you mentioned your journey several times.
Mhm.
How would you describe your journey of discovery? I mean, just tell us how would you describe from symptoms to just what did it feel like?
um, the work that I do is physically taxing sometimes. I'm a birth doula, and I do a lot of flipping around of pregnant women and things of that nature. And so, and I tell people all the time, I've had a complicated relationship with pain for as long as I can remember. So, but it was usually back pain. I've had pain in my back. The first memorable time I was 20 years old and got stuck on a coda bus because my back had literally locked up to the point where I could not move. They had to call the emergency squad to get me off the bus. So you're talking about 30 years ago
Wow.
of pain that didn't make sense for somebody that was not, aged, ill. I was 20. And so there was a lot of back and forth and looking at my back and things of that nature. But here more recently, when other things started happening, it started become to the point where there would be spasming in my back, in my legs, numbness in my feet, pain in my shoulders, and and I'm thinking, do we have a bad mattress? Is it the bed? Is it the position that I'm sleeping in? What is this? Because it was so, because of my issues with my back over the years, I'm not unfamiliar with waking up and being sore. I'm not unfamiliar with, after working with a client, feeling sore. But this was debilitating pain that would drive me to my knees.
Wow.
Or, to the point where it's like I'm crawling just to be able to get from one place to the other. And so then I'm like, this is weird. This is more, my back's getting worse. Yes. And so then the doctor's like, degenerative disc disease. It's like, okay, epidural shots, cortisone injections, all of those things. Yes,
So
ma'am.
you were getting different types of treatments.
Yes.
But it was basically for the pain.
For the pain element. And for the assumption that it was something with my back. When my legs and my extremities started to have issues, like discomfort having the blanket touch my foot. Air going across my foot would be like excruciating pain, and then pain in my shoulders, pain in my arms for no reason and with no relief with, over-the-counter medications. And then I also started to have gastrointestinal issues. I all of a sudden put on 20 pounds. I all of a sudden was completely just bloated and in pain and for no discernible reason. And then I started to have myoclonic jerks.
Now, you said a mouthful.
Yes,
explain that. I know you have a medical background.
Yes,
but
I did not know what that is. Myoclonus or haptic jerks are what we see as sleep starts or hiccups. So, sometimes when you're falling asleep, you jump because you've fallen off to sleep, but then wake back up. One night I was laying in the bed, I was watching TV, I was awake, and my body just started to jerk. I thought, I'm like, am I having a seizure? What is this? and I timed it. I timed it like I would
For
time
medical
contractions,
background,
and it was
yeah.
like one every 2 to 3 minutes, and I'm like laying there, and it'd just be like this, and it would just keep happening. And so I ended up calling the doctor.
Mm-hmm.
They did some questions over the phone to discern whether or not it was a seizure,
Mm-hmm.
and they said, schedule to see your primary care physician. I said, okay, I will do that. That night, it became so intense, and so like it was
The
just the
jerks or the
jerks,
pain?
the
Okay.
jerks and the pain. So it was, I could lay there and feel my body. My hand would go numb, my other hand would go numb, my foot would jerk, and then my whole body would convulse.
Mm-hmm.
And it was a pattern. So I ended up going to the emergency room to seek care. And at the emergency room, they don't diagnose.
No.
So they gave me medicines for Parkinson's.
Really?
They gave me a medication that is usually prescribed for patients with Parkinson's disease to help with tremors and the symptoms.
Okay.
So they gave me that, and they told me, this medicine works for about 24 hours.
Mm-hmm.
And they gave me like 3 pills. It is a strong medication. I was not diagnosed with Parkinson's, so it was just something to help see if it could calm things down. And I promise you, on hour 24 and 1 minute, they started again.
Really?
It stopped the jerking. I still had a dulling ache, but the jerk stopped. And as soon as that medication cleared my system, they started again.
So now this is almost 2 days, it sounds like.
Yes.
Were you able to get in with your primary to get a specialist, or how did that work?
I did get in with my primary, and this is the primary care doctor that was the male before. I actually had my son take a video so that I could show him what was happening. And he said, I don't know what that is.
That's not uncommon for general practitioners.
Yes. And my thoughts, as a lay person are, I don't know what it is either. So one of us has to figure it out, and it's not me.
Right.
Right. And he asked some questions. He referred me to neurology.
Okay.
I went to see a neurologist, so I explained what happened, showed her the video. I left feeling diminished and feeling unheard, because she decided that it was me jerking in response to pain that I felt in my back. And I was like, that's not what I described at all. That's not what I showed you in this video. I did tell her that if I move a certain way, it hurts more and it makes the jerks more pronounced. But in my workup, she wrote that I was jumping in response to perceived pain. And that was a big blow to me. And I do believe there is a direct correlation with the lack of research and the lack of follow through because of my insurance, as opposed to having private insurance, because it was just she referred me to physical therapy.
Really?
Yes.
So completely unheard, did not listen, even with evidence.
Yes.
Yeah, that's a whole nother conversation.
Absolutely.
And so how did you move from there with that being written in your chart? Because what people see is what they believe.
Yes.
To getting where you are now.
Well, because I do work healthcare adjacent, and I am a professional advocate for people that are not listened to, I just started to look. I would pull up medical journals and pull up my test results. And I would look at the test results and then look at the medical evidence and say, what are the correlations? I did mention that to my primary care physician before I switched, and he ended up telling me, he told me what the word for it was at the time, myoclonus, and he said, sometimes people just have it. And I said, from what I've been reading, this can be a direct result to some form of autoimmune disorder. And some of my other symptomology is reference to autoimmune disorder. And my lab work, there's a specific test that indicates that further research should be done or further testing should be done.
Mm-hmm.
And he said those numbers were borderline in my opinion, so I will not refer.
Really? So was this a large hospital that you're?
Yes.
Okay. Okay. And so how, hearing that and no referral, where do you go next?
Well, where I went next was back to that network to find another doctor. I immediately,
Good for you.
I sent him a message. I was like, I'm not being heard. I left it at that and started to look for another doctor that had, I was looking for specifically a female, even though that's still a roll of the dice. But I was just looking for someone that would listen to me. And I think someone suggested just talking to a nurse practitioner.
Okay.
Start there. So I was like, you know what? That's what I'll do. And so I spoke to the nurse practitioner, told her what I was feeling, showed her, the video, and told her about my lab work. And she immediately ordered a new set of labs, rewrote a referral to neuro, rewrote a referral to gastro, rewrote a referral to rheumatology. It was just like immediately like, we need to figure this out, because I told her, I'm not just going to make something up.
Right.
I'm not seeking anything but answers. And this is really challenging. And I had told her about, the fibromyalgia diagnosis and things of that nature and what the medication had done. And it was, yes, it was effective, but when the jerks start, we had to come off of it. She was the one that suggested I come off that medication to confirm whether or not it was the medication. Once we cleared that it wasn't, it was, okay, we need to get to the bottom of what this is.
So it sounds like her philosophy and yours of just having that good patient and physician relationship was better than the previous.
Yes.
And so then with the new test, did it confirm some type of autoimmune disease?
As of right now, so my last tests were, it is October.
Okay.
It is confirmed that there are rising anti-nuclear antibodies and that they are continuing to rise, and that the test that they did with rheumatology suggests going back to neurology just based on some of my other symptoms, because when you talk about numbness and sensitivity to touch and things of that nature, they think nerves. They did do a brain scan to confirm that I was not having convulsions. They did a study where I was not to sleep all night. So I did.
How did that work?
It was actually serendipitous because the weekend of that test, it was on a Monday, I had drove to West Virginia for a family reunion. So I literally just drove back that night, went straight home, showered, and went straight to the test.
So it worked out.
So it worked out. It was perfect timing. I was driving when I lay down. As I was laying down awake, it was happening. Once my body relaxed and I drifted off to sleep, it stopped. And for some reason, it's worse in the summer, which to me also speaks based on the things that I've looked at, that it is some form of autoimmune disease, just based on, I know some people have harder times in different seasons, despite being in menopause, despite being, 50 years old. There were tinnitus symptoms, just ringing in the ear, room spinning for no reason.
Oh yes, that's common amongst autoimmune
Thank
disease.
you.
It's very common.
That is so validating to hear. But just knowing that from what I've read and knowing what I've researched, and then going into like lupus support groups or autoimmune support groups and hearing other people's stories, it's like I don't want to take that on and be like, yeah, me too. But just seeing, that happens. Yeah, that happens. It just added weight to me wanting to push to find out what's happening.
And it sounds like you're continuing to push because you still have some diagnoses, but not like an official diagnosis. And sometimes you will get an official diagnosis, and then a couple of years later, you'll get another official
Yes.
diagnosis, but they know that it's autoimmune.
Yes, and the rheumatologist was willing to put that in my chart,
Good.
that I felt that I see an autoimmune issue.
Mm-hmm.
It's not rheumatological, but more study is necessary.
And that probably came from your blood test and the
Yes,
monitoring of your blood test. So that's a start, because once you have that autoimmune documentation,
yes,
because that's what everybody goes off from, insurance, other specialists, and now you have somewhat of a team, which it seems like things are coming together. I love the way that you described your journey, because it was so detailed that others who are trying to figure out what's going on can say, hey, these are some symptoms that she had. I really appreciate you doing that, because it really, you delve deep into the descriptive component.
yes,
And one of the reasons why I'm doing this is that I couldn't find a lot on YouTube, especially with the individual of color. I couldn't find a lot from real people.
yeah.
I found a lot of medical physicians and specialists, but real people going through it. Then my last question is, if you knew what you know now,
Right.
what advice would you give that individual?
My main advice, which is advice that I give for myself, advice that I give to my clients, and advice that I would give to anybody who was struggling with this, is learning how to advocate for yourself. Learning that you don't, we trust the medical community. They are educated. Um, that is what they do. But for us as individuals, if they don't know our familiar history, if they don't know how we deal with pain, our coping strategies, they're not aware of that information. They're
Yes.
looking at our medical chart. If you're not unable to express that and get somebody that understands that, find another doctor. It's as
Huge.
challenging and as scary and as hard as it might seem. The doctor that's been your GP for years, taking care of just your everyday ills, might not be who needs to take care of this
That's
thing,
huge. That's
you
huge.
know, and you have to be able to know that that's okay. We don't have to just stay with the doctor that we're with or with the practitioner that we're with. We don't have to do that. It might be tricky and it might be challenging.
Mm-hmm.
There was a lot of looking through my, covered network doctors to see and calling to see if they were accepting new clients. That we don't have to be limited because we don't know what's going on.
Mm-hmm.
We have every right to figure out. We know ourselves best. When somebody said it was perimenopause, I'm like, this cannot really be what women suffer. There is no way that this is what women are, because I think somebody would have told me.
Absolutely.
Now you're going to start jerking. Like, nobody. I've never heard that before. And I appreciate the fact that because a doctor didn't listen, I was empowered to find somebody that would. Find somebody that'll listen.
You heard it from the expert, the one that's going through it. Find someone that will listen.
Yep.
Well, once again, thank you for being here. I appreciate it. Your information is invaluable. And I'm also going to be praying for you, that the official diagnosis will come, another official diagnosis will come.
Ma'am.
But I walked away even more empowered because of your journey in sharing with us everything that you've done to advocate for yourself. It makes me want to even just advocate even more. And so thank you for your story.
You're
Appreciate
welcome.
you.
Absolutely. Thank you so much.
All right.